Good morning. Our topic for today is Vibrio, Aeromonas, and Plesiomonas, and Campylobacter. Well, just to inform you, you just have to study these slides. This is also included together with Mycobacteria in your final examination. So, lahat ng naka-PowerPoint na video ko will be included. So, 4 na topic lang yon. Although, we still have a lot to discuss and a lot of video to be given. Please make sure that you're watching all the videos, you're all listening, kasi in between those videos are plus points to be added to your, not directly added to your grade, but to some of your quizzes and exam para naman if ever na kailangan nyo ng panghatak, may panghatak po. So, Vibrio plus Vibrio, Mycobacterium, Haemophilus, and Pseudomonas will be included. Those 4 PowerPoints that will be given to you through this video will be included in your final examination. Also, I will be sending a copy of this what do you call this? PowerPoint to your Google Classroom. So please always visit your Google Classroom. Again, there are 5 videos that will be sent to you. However, dun sa 5 yon, of course, pang-anim yung Mycobacteria. Yung sa 5 yon, 3 lamang dun yung kasama. Inuulit ko, Vibrio, Pseudomonas, and Haemophilus. Okay, to start with, my God, what is happening? What is happening? Wait lang po. I have to pause. Okay. As I've said, we have Vibrio species. Okay. Now, Vibrio has 11 species that have involved human infections. Okay. This is common, of course, this is found in water. Okay. Now, more often than not, this Vibrio species can be found in fresh water, brackish water, or even in salt water. Pero mas madalas siya sa brackish water. Okay? The epidemic is cyclical. So when we say cyclical, it appears in a certain season of the year. Okay? Na sometimes it paulit-ulit lamang. Okay? Causative agent of cholera, rice watery, the description of the stool is rice watery stool. If you have this cholera, you could experience large loss of water and electrolytes, 10 to 30 movements per day. So come to think of it, if you visit the comfort room 10 to 30 times a day, and then talagang massive bowel movement talaga. Dehydration and hypovolemic shock is usually the cause of death. Now, it is basically due to fluid loss, and this is caused by the toxin released by your Vibrio. Now, considering the large loss of water and electrolytes, dehydration, and hypovolemic shock, ito yung tinatawag nating when you are infected, you have, washers, woman, washer woman's apostrophe S hands. Alam nyo yung kamay nyo pag nababad sa tubig na matagal, like when you're swimming or you're doing your laundry, di ba yung nangungulubot yung inyong mga palms? It is because that feature is seen in cholera infection or in cholera simply because of the loss of fluid and electrolytes. Okay? Now, what are the risk factors of Vibrio? If you travel to coastal or cholera endemic areas where there is an inadequate sanitation, this is very common in developing country again. Now, the undercooked or eating of undercooked or raw seafoods, warning signs for raw oysters. Alam mo yung talaba? Masarap yan eh. Now, actually, this is common in Japan, although it's not a developing country, but they had cholera cases because of eating undercooked or raw seafood. Increased use of recreational water facilities, it would mean that there is an increased exposure. Say for example, a swimming pool that is not being cleaned or filtered every time. Tapos meron siyang Vibrio, and then you happen to take a dip on it. Tapos pagka dip mo, nalunod ka, nakainom ka, no? So that's it. Now, general characteristics of your Vibrio. These are facultatively anaerobic, small curved gram-negative rods. It's pleomorphic actually. Comma shape. Okay? Oxidase positive. It reduces nitrate to nitrite. Take note of the exception, people of the Philippines. Your Vibrio reduces nitrate to nitrite except Vibrio mechnikovi. Okay? Vibrio mechnikovi. Now, these are the clinical infections associated with your Vibrio. As palakihan natin. Okay? So, you have Vibrio cholera 01. Okay? This is the most common actually. Okay? Now, it is written here naman what are the diseases that it can cause. The alginolyticus, which causes wound infection, ear infection, Vibrio vulnificus, Vibrio gastroenteritis. Okay? Now, this is the microscopic morphology of your Vibrio. This one, A is a gram stain smear, and the other one is the acridine orange stain of Vibrio cholerae. So, take note that your Vibrio is susceptible to Vibrio stat disc. This Vibrio stat disc is the one that will separate Vibrio from your Aeromonas, kasi they behave the same. Okay? However, madi-differentiate mo sila using the Vibrio stat disc, and also in the 6.5% salt broth tolerance test. Okay? So, your Vibrio produces a positive string test. Positive string test, you have to emulsify a 2 to 3 colonies in a drop of sodium desoxycholate. Pagka emulsify mo na siya, you pick it up. The colonies can be picked up like a string using a loop. Generally, not a great test, but does help in suspected cases. Please take note that your Vibrio are halophilic except for the 2. Okay? All are halophilic except V. cholerae and V. mimicus. Okay. Now, this is the Vibrio stat disc. Okay, sabi ko nga susceptible ang Vibrio. You can see this part. Ayan po. Ayan, nakikita nyo ba yung bilog na iniikot ko? Ayan. Compared to your Aeromonas, which is resistant. Okay. So, here's a table that would differentiate Vibrio from Aeromonas from Pleishiomonas. Okay. All of which will react negative in gram stain. All are oxidase positive. Now, resistance to O129 at 10 microgram. Variable po ang Vibrio. Aeromonas is positive and Pleishiomonas is variable. At 150 gram, negative po ang Vibrio, positive po ang Aeromonas, and negative po ang Pleishiomonas. Okay? So, ibig sabihin, resistance yung Pleishiomonas at 150 microgram. And so on and so forth. Please, kindly read this one, okay? Now, antigenic structure, most important species are V. cholerae and V. parahemolyticus. Again, most important species are V. cholerae and V. parahemolyticus. H. antigen, these are found in the flagella. It is not useful Dahil lahat naman may mga ganong antigen. I mean, it's not useful for identification. Okay? O antigen, V color-A, okay, it has 6 serogroups. O1 are the most common. You classify as O1 and non-O1. Pag non-O1, it causes a milder disease. Okay? It does not produce cholera toxin. O1 has biogroups. This is the classic and what we know or what is very common to us, the L-Tor. I would just want to share to you that this L-Tor was the first isolated biogroups, okay, when there was an epidemic of cholera. This was first isolated in Bangladesh, the L-Tor. Okay, now your O1 contains subtypes. Again, you have O1 who has subgroups. Ang subgroups niya, the classic O1 and the L-Tor O1. Now, yung O1 has another subtypes. You have Ogawa, Inaba, and Hikojima. Okay? These three strains or subtypes are all Vibrio cholerae, only that each subtypes are found in a specific geographical distribution. Nung ako po ay nag-aaral, ang sabi ay ang Ogawa ay India. But recently, I have learned from our ITM, you have the right to correct me if I am wrong, or you have the right to object if I stand to be corrected. Pero to date, what is common in the Philippines is your Ogawa. Okay? This one, the Ogawa subtypes is found in the Philippines. The Inaba is found in Japan. And the Hikojima subtype is found in India. Okay? Again, subtypes. Actually, just so recently, nung mga tag-ulan, June, July, at lagi yon every June and July, we have an epidemics of cholera somewhere in Bicol. Tapos, nakarating na siya ng Pampanga. And our ITM have discovered that subtype is Ogawa. At ang sabi po ay Ogawa lang naman yung subtypes na meron sa Philippines. Okay? So again, remember, you ask Sir Gion, iba yung sasabihin niya kasi iba yung naituro ko sa kanila. That was 2011. Oo. Ay, nalaman ko lang ito 2016. 16 nga. 2016 ang malaman ko that Ogawa is found in the Philippines. Okay? Now, clinical sources, generally, of course, we need to submit a stool. Okay? Drinking or eating organism from tainted water in Gulf Coast of the United States, other countries from lack of sanitation. Sometimes wound sources from fishermen can manifest as septicemia. Occasionally, this would cause otitis media from swimming in tainted water. So, anong bonus number 1? May bonus kayo. What is the Vibrio species that would cause otitis media? When we say otitis media, ear infection. Kasi sabi ko lang kanina nandun sa table. Okay? So, bacteria colonize the small intestine and releases toxin. Diarrhea is caused by the cholera toxin, also called as choleragen. Okay? Subunits and 5 multiple binding BU subunits. The B subunits bind to GM1 ganglioside receptor. A2 subunits allow A1 subunit to enter. A1 subunit stimulates adenylate cyclase by inactivating AG protein, which in turn activates your CAM, which leads to hypersecretion and electrolyte loss. Okay, so this is the picture of the action of your cholera toxin. Now, treatment. You have to treat it IV and oral fluids containing electrolytes. The antibiotics will only reduce the organism. Pero initially and basically, you have to address the loss of fluids and electrolytes. Okay. The Vibrio parahemolyticus. This one is discovered in Japan in 1950. The parahemolyticus was the causative agent of summer diarrhea of Japan. However, this is found worldwide, limited to areas with 1% to 8% sodium chloride. It's associated with seafoods, especially when you eat raw oysters. Parahemolyticus Parahemolyticus yung nagkakos ng cholera type. Okay? Symptoms. The symptoms will develop after 24 to 48 hours of eating. So, 1 to 2 days after eating contaminated food, you will experience water diarrhea and cramping of the stomach, sometimes vomiting, but there's no fever. So, what are the virulence factors of your V. parahemolyticus? The heat-stable hemolysin, which is responsible for the Kanagawa phenomenon. Ano yung Kanagawa phenomenon? Kanagawa phenomenon is hemolysis in a blood agar plate. Now, the blood agar plate used for Kanagawa phenomenon or in identification of Vibrio parahemolyticus is what we know is known as the ko sana mabasa nyo to. Wagatsuma agar. Again, Kanagawa phenomenon is blood hemolysis in Wagatsuma agar. Your Wagatsuma agar is actually a blood agar plate that is intended for the identification and isolation of your V. parahemolyticus. Okay? Malinaw yun ha. Kanagawa phenomenon because of the heat-stable hemolysin, which is one of the virulence factor. You can observe Kanagawa phenomenon using a Wagatsuma agar. Using a high salt mannitol media containing erythrocyte shows hemolysis. Some strains of your V. parahemolyticus, not all ha, are urease positive. Next, V. vulnificus. This one is found on the Atlantic, Gulf, and Pacific coast. This one is known as your lactose positive Vibrio. Acquired infection from raw or undercooked seafoods. This could cause septicemia, particularly in people with increased serum iron. Occasionally can be found in wounds. Okay. V. alginolyticus rarely isolated. This is least pathogenic, mostly external sites like ear infection, wounds, or burns. Sailors or those in constant contact with seawater. So how do we culture your Vibrio species? Your BAP works well, okay, since it contains enough salt for Vibrio. Mock plates can be used. All are lactose negative. Again, all are lactose negative except B. vulnificus. If clinical history may indicate Vibrios, use TCBS, which stands for thiosulfate citrate bile salt sucrose agar. Again, thiosulfate citrate bile salt sucrose agar. Now, you can identify it if it is Vibrio cholerae or V. alginolyticus if the TCBS turns yellow. Ulit. V. cholerae, V. alginolyticus if the TCBS turns yellow. If the TCBS is green, then most likely you have isolated V. parahemolyticus and most V. vulnificus. Okay? Now, this is an example of your cholera on your TCBS. Look at that colony, yellow. So, it's V. cholerae. Ano pa yung isa pa na magye-yellow sa TCBS? Okay. Now, these are the reaction in 8 key differential test for Vibrio cholerae. please take note of the test that is most commonly used in the laboratory for the identification of your Vibrio species. You have growth in nutrient broth with no NaCl added and with 1% NaCl added. And then look if they will grow there or not. But almost all of the Vibrio species would have a positive result or positive growth if that broth is being added with 1% sodium chloride. Kasi nga, all of them are halophilics with few exception. Okay? Now, to the broth with no NaCl added, all are negative from group 2 to group 6. However, group 1, which includes V. cholerae and V. bimicus, will still grow on the nutrient broth. Oxidase production, kindly check the result. Nitrate reduced to nitrite. Okay. Group 3, group 4, group 5, and group 6 will reduce nitrate to nitrite. Okay. Next. Now, here are the 4 major clinical Vibrio species. Okay. These are the key differential biochemical tests to separate groups 1, 5, and 6. Okay, Vox proscour, 1%. Okay, 0 yung sa fluvialis and group 6 also. Motility. Okay. Sucrose. There are some who will not give you yung number class. Ito is 75%. Sorry. So it means that 75% of the V. cholerae species will give a positive result in Vox proscour test with 1% sodium chloride. 99% of V. cholerae species will give a positive motility test. 100% will produce acid from sucrose for V. cholerae, 99% from dimannitol, 8% for cellobiose, and salicin, 1% for V. cholerae. So, basta kapag merong value dyan, big sabihin, positive sila. Only that, not all species would, not all isolates will produce the same reaction. Okay? Sa mimicus, it will not produce, acid from sucrose. Okay? Now, let's go to Aeromonas. Tapos na ang Vibrio. O, diba, ang dali lang ng Vibrio. Wait lamang po. Baliktad. No, it cannot be. Alam ko, Inaba is Japan. India, Hikojima. From my old notes kasi class, yung Ogawa, Inaba, Hikojima. Ogawa was isolated in India, Inaba was from the Philippines, and Hikojima was Japan. Until, sabi ko nga, noong 2016, I was being corrected by RITM. Ogawa was from the Philippines. And, I don't know if Japan is, Inaba is Japan and Hikojima is found in India. The only thing that is clear to me, sabi ng prof ko noon, so we were being asked, Inabasa na kita, so we all answered India. Sabi niya, hindi, like the, India, Inaba, hindi daw yun ng mnemonics. Pag India, ibang letter daw magsisimula. So, it's Hikojima. Parang ganon. So, again, you're free to correct me, but as far as I know, inuulit ko, importante kasi lumalabas to sa boards Ogawa, Philippines, Inaba, Japan, Hikojima ay India. Okay. Now, please take note that your V. cholerae can be cultured in balik tayo sa Vibrio. Your Vibrio can be cultured using your alkaline peptone water Your thiosulfate, citrate, bile, sucrose, yun yung agar. And, ito pala importante, for Vibrio cholerae, again, Vibrio cholerae, your Vibrio cholerae exhibits Pfeiffer's phenomenon. Okay? Your Vibrio cholerae exhibits Pfeiffer's phenomenon. Okay? Pfeiffer's phenomenon is actually a reaction in a blood agar plate. Okay? Hemolysis din yan. Okay, so what else do I have to add? None so much. Except for the parahemolyticus. Kung yung inyong Vibrio cholerae can be cultured in alkaline peptone water alone, ang inyo pong V parahemolyticus can be cultured in APW, that's alkaline peptone water, plus 2 to 4% sodium chloride. Again, your Vibrio can be cultured in alkaline peptone water alone. However, your parahemolyticus can be cultured in alkaline peptone water with 2 to 4% sodium chloride. Okay. Now, let's go to your Aeromonas. Class Aeromonas, hindi siya masyadong common. However, it is it is noteworthy that there is Aeromonas that we can find. Actually, this is common in lake, brackish water, in lake water, okay? Remember that this is oxidase positive. It ferments glucose. These are gram-negative rods, straight, okay? Unlike your Vibrio, which is curved, para siyang comma. Generally found in most environments, similar to Vibrio. Can be found in cold-blooded animals like snakes, lizard, and newts. Okay. Aeromonas can cause gastroenteritis secondary to drinking of untreated water or contaminated seafood. So you have various type of diarrhea. You have acute secretory diarrhea with vomiting, acute dysenteric form with blood and mucus, chronic diarrhea which can last for more than 10 days, and cholera-like disease with rice water stool. Also, this is similar to traveler's diarrhea or turista diarrhea. Okay. So, wound infection, various injury while working in tainted water. Most common is your Aeromonas hydrophila, which causes wound infection. Use of leeches during plastic surgery to relieve congestion and swelling. That is one of the most common cause, usually in Japan. And serious infection can result. Now, septicemia is secondary to infection from a Veronii or before Sobria. Sorry, a Sobria. This can cause septicemia in immune-compromised patient with liver disease, and when there is traumatic injury. So, these are Aeromonas showing beta hemolysis and growth in McConkey. Let's enlarge, okay? Yan, oh. Meron siyang clearing, di ba? So, pero parang may alpha din siya. Hindi, clearing talaga. Clear yung kanyang hemolysis. So, beta hemolysis. And this is the growth in McConkey agar exhibiting lactose fermentation on MAC. So, pink. Now, these are the differential characteristics for mesophilic clinical Aeromonas species. Again, lalabas sa exam yan. Yan. So, please take note of the reaction of which, okay? Next, Pleishomonas. Pleishomonas are gram-negative rods that may appear in pairs, or short chains. Antigenically have some similar features to Shigella, but much lower virulence. This is common in tropical and subtropical waters. These are the biochemical reaction of your Pleishomonas. It is oxidase positive, glucose fermenting, facultative anaerobic, and motile. Okay? So, what are the disease that your Pleishomonas can cause? Gastroenteritis, These are known for an outbreak in Japan from raw or undercooked seafood or tainted water. This causes watery diarrhea, subacute or chronic disease. This may cause dysenteric form of disease. One of these accompanied by fever and abdominal pain. Now, vets and zookeepers are at risk, especially for extraintestinal infection. This can be found again in cold-blooded animals like snakes, lizards, and newts. So, along with your Aeromonas, may Pleishiomonas ka pa, ay di perfect. Okay, so when we want to differentiate Pleishiomonas, okay, from other Enterobacter or Enterobacteriaceae, we do the oxidase test. Sabi nga natin, pag Enterobacteriaceae, ang code niyan 1 cup. Pag Enterobacteriaceae, ang code niyan 1 cup. 1 cup. O-N-E, di ba? O stands for oxidase, N-E negative. So, 1. Tapos, C-A stands for catalase test, and P will stand for positive. Kaya 1 cup. So, Enterobacteriaceae, 1 cup. So, oxidase negative sila. However, your Pleishiomonas will give you an oxidase positive result, which rules out Enterobacteriaceae. This one is sensitive to vibriostatic agent, which rules out Aeromonas, because Aeromonas is resistant to your vibriostatic agent. There is no growth in high salt, rules out Vibrio. Vibrio will grow in a high salt content, but not your Pleishiomonas. Diba? Like this ka, vibriostatic. Aba, sensitive. Ang sabi natin, ang vibriostat, pagka vibrion, will yield sensitive reaction, but not Aeromonas. And nag-test ka, tapos, bigla kang nagkaroon ng sensitive. Will you jump into conclusion that it is Vibrio already? No. You have to do the growth in high salt water, like alkaline peptone water with additional 2 to 4% salt, which can support the growth both of the parahemolyticus and the cholerae. If it does not grow in that alkaline peptone water with high salt, then it is not Vibrio. It is therefore your Pleishiomonas. Nagets ha? Okay. Inositol fermentation. This will confirm that it is Pleishiomonas. Okay? Special media, if thought to be involved, IBB. IBB stands for inositol brilliant green bile salts. The colony will appear white or pink. Okay? Compared to other coliforms which will appear green or pink. Campylobacter species. Okay? Sila naman importante dito yung Campylobacter jejuni. Okay? Many subspecies and biobars, jejuni subspecies jejuni, and fetus subspecies fetus and others. These are microaerophilic, so mahirap siya i-grow. Non-spore forming, gram-negative. Remember the hallmark appearance, the seagull appearance will always talk about jejuni. Okay? These are oxidase positive and catalase positive. Motility, this one is positive in motility with a darting motility. Dalawa na tatandaan nyo sa jejuni. Seagull wing appearance and positive darting motility. This is non-fermentative. So, C. jejuni, C. coli, and C. lari are similar. Most common diarrheal illness worldwide. Diarrhea with mild abdominal pain. It may cause cramps and bloody diarrhea, which may follow with fevers, chills, and rarely nausea and vomiting. This is self-limiting if you're immune competent. So when we say self-limiting, it will only last for 2 to 6 days. After that, okay na. However, you may remain carriers for several months. Okay? Pag sinabi carriers, magaling ka na pero you can transmit the disease. The Campylobacter fetus. Most frequently isolated from blood cultures. Immune-compromised and elderly patients are affected. Known to cause abortion in cattle, sheep, and pig. Abortion, hindi sa tao, ha? Cattle, sheep, and pig. Kaya siya ay Campylobacter fetus. So, these are the member of your Campylobacteriaceae and other Campylobacter-like organism. Okay? Here is the table for Campylobacter species and their clinical significance. Helicobacter pylori. Oh, yan. Common yan. Colonizes 20% to 40% of adults in the United States. This one is a major cause of chronic superficial gastritis. Meron akong chika sa inyo. Ang Helicobacter pylori, meron daw tong predilection sa type O individual. Blood group O individual. Ang Helicobacter pylori commonly isolated from blood group O individual. Okay? Again, going back, it does not invade the tissue but does live in the mucus covering the surface of the stomach. It produces urease to break down urea to ammonia and neutralize the stomach pH. Produce a low-grade inflammatory response and damages tissue resulting in ulcer. Actually, siya yung bacteria that would cause ulcerations or ulcer. This is associated with type B gastritis causing gastric carcinoma or stomach cancer. So, ibig sabihin, ang type O malamang magkaroon ng stomach cancer because of Helicobacter pylori. Okay. A presumptive identification of Helicobacter, you inoculating Christensen's urea medium, the rapid color change in 2 hours, urease test yan, urease test, this is used in urease test, the Christensen's urea medium. So, rapid color change in 2 hours, magiging pink. Biopsy specimen of the stomach, you stain it with Gimsha, gram or silver strain. You may do the urea breath test. You have to ask the patient to drink the carbon 14 labeled urea degraded by urease activity releasing C14 and CO2. Okay. Next, how do we culture your Campylobacter and Helicobacter? For these two, you may use the Campi blood agar plates. Campi blood agar plates is for Campylobacter. This is a Brucella agar base with 10% sheep's blood agar. Again, Campi Bap, you call that Campi Bap kasi Campi blood agar. For Campylobacter, actually, it is a Brucella agar. It is used for the isolation of your Brucella. You just have to add 10% sheep blood agar to make it as a Campi Bap. You may also use your Sciromedia. It's a blood agar base. The only thing is that you use the lysed horse RBC. Or you may use Botzler or improved version V media. It is a thioglycolate based agar with 10% sheep RBC. And grow plates in a microaerophilic, capnophilic atmosphere. So, decrease oxygen. The oxygen should be around 5 to 10% only and high in carbon dioxide, which at least 10% carbon dioxide. Okay. Tandaan yung mga sinabing agar, ha? So, this is your Campylobacter species culture media. Your Campybap blood agar. The base is Brucella agar and 10% sheep red blood cell. It is incorporated with the following antimicrobial agent: vancomycin, trimethoprim, polymyxin B, amphotericin, and cephalotin. Bakit may ganyan? So that we suppress the growth of other bacteria. Same with your Scaros, you have the base and the additional antimicrobial agent. Remember that some antimicrobial agent are being added to the medium just to suppress other growth of bacteria, and that you can zero in the isolation of that specific organism. Here is the biochemical test that will differentiate Campylobacter, Arcobacter, and Helicobacter species. Okay. Aralin nyo lang, daanan nyo lang. Okay, that's the end of it. So, after this, meron pa pong isa, Haemophilus. So, we have and Pseudomonas. After that, yung apat na yon, again, Mycobacterium, meron ng diba? May question ako, may bonus question sa in between. Okay. So, Mycobac, Vibrio, ito yun. Tapos, Pseudomonas, tapos Haemophilus. Okay? So I'll be uploading this at the soonest possible time. Thank you.